I am newly postpartum. This girl is about 3 days old right now. But one of the questions that we get a lot is, what kind of belly band, belly wrap, corset should I get to help support my healing postpartum, to help heal my diastasis, to help my uterus shrink down? And I want to debunk some of the misconceptions involved with belly bands and binders postpartum, because some of them may actually be causing more harm than good for you. But I want to share how they can be helpful for you and how to use them to support your healing after birth. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and now mom of 4. This is my newest little one here, and I am currently wearing the Babe Bloomers, which is a gentle compression garment to help support my healing. But there's a lot of misinformation out there on what type of belly binder you should get, corset, waist trainers. There's so many different marketing ploys out there advertising that wearing something can help shrink your waist, heal your diastasis, bring your uterus down, and all of them are kind of marketed under support your healing postpartum. Unfortunately, some of these devices can actually cause more problems than good, and so I want to break down how to find one that is actually going to help your healing, and then what to look for to avoid so that we don't have more issues postpartum that you might already have. So here's how to find a good belly band to help support you healing postpartum. First, we're looking for gentle compression. So we don't want our belly bands or garments to be so tight that it's preventing us from being able to breathe. But we do want that gentle compression because that's going to help with blood flow, lymph flow, and also just to provide a little bit of support, which is especially helpful if you're going to be getting up and you have to get out of bed because you maybe have an appointment that you need to go to, you have older children that you're taking care of. Not all of us get to just lay in bed and rest for 5 days after birth. If you have that opportunity, that's wonderful. But if you don't, wearing the garment can be really helpful for that. So I've been wearing this even though I have been mostly laying in bed just for that gentle compression to help, but I don't wear it all day. So if I know I'm going to be moving a little bit more, I'll throw it on, but I don't always wear it. Other things to look for, especially if you've had a vaginal birth, is perineal support. So these are like underwear. They're pretty thick. So they're, I guess a 1/16 of an inch thick. And so they are very supportive, but they're also providing that bottom up support as well with the perineum. And so if you can find some sort of supportive garment that also has perineal support, that can be super beneficial. Now, if you've had a C-section, belly bands that have a little bit more structure to them can be super beneficial, where it's chest around the belly, just to provide that external support, which can be really helpful, especially if you have to like sneeze or cough, to give you a little bit of that splinting. When it comes to wearing compressive garments or belly bands postpartum, we don't want to wear them 24/7. So really just when you need it for about the first 2 to 4 weeks postpartum, because we don't necessarily want it to become like a crutch for us either. Now, what do we not want in a belly band? Like, what type of belly bands are going to cause issues for us in the postpartum? If it's advertised as a waist trainer, a corset, if they say that it's going to heal your diastasis or shrink your waist, any sort of those marketing things, it's not a good idea. Don't buy that belly band. Don't buy that belly device because it's going to cause more issues. If we have a belly band that is so tight that you can't breathe, or it causes downward pressure onto the pelvic floor, it's going to cause some issues. And so it can potentially increase prolapse symptoms. It can potentially cause more pelvic floor issues. Physically bringing the abs together does not heal them. It does not heal diastasis. It's really just going to cause more issues, especially down into the pelvic floor, by creating a dysfunctional breathing pattern. And so if we cannot expand in our abdomen, that pressure has to go somewhere, and it's going to be down onto our weakened pelvic floor. Even if you didn't have a vaginal birth, your pelvic floor is still impacted by pregnancy, and it's still in a weakened state in this early phase postpartum. And so it's really important that we're not putting too much downward pressure on that area. So if you're buying a belly band with the hopes that it'll heal your diastasis, it'll close the gap, don't buy it because it's not going to be beneficial for that. We need the tissues and the muscles to get stronger and denser to help heal the diastasis, not physically bringing them together with a belly band because again, it's probably going to cause more issues than actually help you. So when it comes to a belly band, we want to look for something that is going to be gentle compression, just to provide that little bit of extra blood flow, lymph flow, help with that gentle support, but it's not going to be so tight that it's increasing downward pressure onto the pelvic floor. If you had a vaginal birth, looking for something with perineal support can be super beneficial. These are the Baobab bloomers that I really like wearing postpartum. It does have that perineal support as well. MamasteFit is another great brand that provides perineal support, and there's other really wonderful brands out there that do provide that support from the down up as well. If you've had a C-section, looking for a more structured belly band can be really helpful. Your hospitals will sometimes give you one, but Bodily has a really wonderful belly band that I recommend to all my C-section clients because it's got that support. It's still like a really nice material, so it's not irritating, but it's going to help to provide even more external support against your C-section scar. Whenever we're wearing any sort of belly band device, we want to make sure that it's not so tight that it's increasing downward pressure, because that's going to cause more issues than help. Belly bands are not going to heal a diastasis. We're really just looking for that gentle compression to help support our healing postpartum. I'll be sharing more about how I am recovering in this early postpartum phase and returning to fitness about a month or so away from now. So if you want to check that out, be sure to subscribe to our channel so you get updated whenever I release new vlogs sharing my personal journey. If you want more support throughout your postpartum, be sure to check out our online postpartum courses. We have education courses to include infant massage, infant CPR. We have fitness programs to help you return to fitness to feel strong again in motherhood. So check out all of our options on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online offerings. And we'll also link our favorite belly bands down below.